So it's a carrier of information. So it's not quite a stem cell because a lot of patients have asked me, is this stem cell technology? Do I say yes or do I say no?
So it is stem cell technology because it is kind of the brain of the stem cell, but there is no stem cell product in it. So
The brain of the stem cell.
Yes.
That's interesting. Okay.
yeah, it's essentially the brain of the stem cell, and then you're able to really load up the vehicle with all the peptides and polypeptides and really the proteins and cytokines and interleukins that the body really needs, for processes of healing your skin.
We're back to the healing of the skin, the tissue repair, regeneration, and what I learned in my time in plastic and reconstructive surgery, when a patient gets burnt or injured, they go through an inflammatory process,
Yes.
and they go through a wound healing process of inflammation, proliferation, and then maturation. And what we're doing now in the clinic is we're inducing certain levels of controlled trauma, whether with lasers, microneedling, radiofrequency. So is this product here to help heal?
Absolutely.
Our skin.
Absolutely. So what we have is actually a 3-step process. And so your first step is what we call detox. And so what detox is, it's a 5-day treatment prior to any energy-based device or really kind of anything that you're going to utilize to cause inflammation and insult to the skin. And what this does is actually stimulates autophagy. So you're going to actually clean up cellular debris. And it's also going to stimulate hyaluronic acid production. So the skin gets very hydrated because hyaluronic acid production also attracts water to the skin. And we all know that well-hydrated skin, well-toned skin will receive energy-based treatment much better.
Correct.
So you'd utilize this prior to the treatment. And then day of the treatment, you utilize the EXO product itself.
Okay.
And what this is a robust anti-inflammation and stimulation of collagen, elastin, and hyaluronic collagen, elastin. And you mentioned the inflammation that we do cause kind of controlled injuries with
Yes.
energy-based devices, whether it's RF microneedling or laser therapy. And what we're able to do actually is mitigate a lot of that inflammation. Where we don't want to get rid of all inflammation because it is a good process for healing. We decrease it by a factor of about 61%.
Wow.
And so we increase the healing time because we really speed the body through the inflammatory process
Yes.
and get to the proliferative phase much faster.
Right.
And then in your recovery, then you have repair. And again, repair is a 5-day recovery process, again with the 10 ampules inside, so twice daily. And what that is a continuation of the anti-inflammation and stimulation of further stimulation of collagen, hyaluronic acid, and elastin production as well. So it's really it can really be a treatment by its own because you are getting really a stem cell treatment and stimulation, of the building blocks of our skin. But I describe it really as a treatment within a treatment because it's typically paired with any type of energy-based device and allowing you to really confidently treat the skin and know that they're going to have a really quick recovery, much robust, up to about 3 times faster. So it's really remarkable. And we've seen it paired not with just energy-based devices, but also with neurotoxin injection and filler injections as well, especially with the lips. It's very remarkable how quickly the patient will recover and almost look like they did not have anything done really, because it really does mitigate that acute swelling.
And that's what they want.
Yeah.
Our patients want a safe treatment first and foremost.
Absolutely.
They want a speedy recovery because they don't want to go out looking done or looking like they're going to have much or any downtime, and they want a result.
Absolutely.